Welcome back, folks, to Free My Pain Now with Dr. Matt DeDuro and a second-time guest. You're our first second-time guest.
Right.
So this is Dr. John Mullins. He's a wonderful plastic surgeon here in Atlanta, but he's had the MTS unit or the tissue regeneration technology device.
Right. 2 years.
2 years now. And I was with you that first time when I got to train with you when we worked on that gentleman with the terrible foot that some of us have seen and some of our other videos. You're doing some amazing work with wounds and ulcers and diabetic ulcers. And
really, I'm getting unexpected results that I'm happy with. That I can't deny that there is a positive effect coming from this acoustic wave therapy, and I'm getting more excited about it and using it in more and more different clinical situations. And I'm really happy with this. I think we're really on to something that's going to make a difference.
The hospital calls you in for tough cases, gunshot wounds, infections.
True. I somehow managed to gather up some of the more difficult wounds and the more difficult patients that have other problems with healings besides just the normal thing, with the diabetics and other syndromes that make it difficult.
We have to give a shout out to TRT because they did get a Class 2 clearance from the FDA.
Absolutely. That has finally come forward. They've been seeking this clearance for several years and have finally achieved it. And so it's got something that there's a code. There's
codes coming. It'll be,
can,
it was December of 2019 that came through. And, this will open up to a lot of other plastic surgeons and wound specialists. Correct?
Well, it certainly should. And there's data out there. There's clinical data, and there is science behind this. And I would just encourage my colleagues to at least give this a try. Everything from difficult wounds to salvage of limbs to more difficult things like possibly indwelling infected foreign body type stuff like artificial joints and things like that. I've even had some success with some keloids.
That's a scar. A scar that's
a hypertrophic scar, but it's even more than hypertrophic. And it's been a tough condition to
work with.
And have some promising results. Return of sensation.
That female patient.
The neurogenesis just saw her again today, and for actually her third treatment, and she's reporting excellent results, and is just thrilled.
She's the one that got her feeling back around her areola and had the erectile dysfunction.
Right after 5 years of totally insensate. Couldn't even feel anything touching the nipple areola complex. And now she has the other. I'm treating her now for a post-operative procedure that I did because I'm finding that it's helpful in pain control. And I'm hoping and I think I can demonstrate that I can have a decreased use of opiates by using this to control pain post-operatively.
That's amazing. I mean, we have an opioid epidemic. We talked about it on the last show. It's, if this could happen, like we're talking with a big group of oral surgeons as well here in Atlanta because, after they have the wisdom teeth pulled, there's a lot of pain and discomfort, and sometimes they're written strong opioids. That might be the first time that teenager is exposed to that med, and then sometimes it's 1 or 2 days of being on those drugs that it really changes the morphology of your brain and the way your risk reward is.
Yeah, I think the longer we can go without having to experience opiates is probably a reasonable goal for all of us that do surgery.
One of the things that was really groundbreaking was when Dr. Goldstein actually showed your PowerPoint of different scars and wounds healing, and fingers growing back. Tips of fingers getting cut. Just amazing work, Doc. And
I've been real gratified, and I must say I approached it without any great expectations, and have been surprised at how well it's done.
Yeah, I'm obviously I'm a big believer in it, and I'm flying all over the country, and we're putting these devices. First goal is to get one in every state, and then we want to get them in every major metropolitan area, and you're going to help with that. End of March 2020, we're going to have a summit where we'll actually have different providers and practitioners come into Atlanta, and we'd love you to present that PowerPoint then.
I'd be happy to share this.
You will be our keynote speaker.
With anyone.
We'll be lucky to have him.
Be great.
And so there's one other plastic surgeon out in Beverly Hills who has one, correct?
That is correct. He's a combination urologist and plastic surgeon.
Dr. Gary
Adler.
Adler. And he's nationally renowned.
Well, and he's closely associated with Dr. Goldstein. And so some of these uses of it, particularly in some female conditions, has been promising.
And for ED, for men. And they've done some great work. And I know we talked about the PGAD, persistent genitalia arousal disorder.
Yes.
Dr. Goldstein in San Diego runs the sexual wellness center there. He's, I think, 10 for 10 with this now.
That's what he's reporting. And that we recently had an article out about how really disabling this condition is for women. And it needs to be taken seriously. But he's had better results than any other treatment modality so far.
It's a very painful condition, and people will actually look at suicide because of it. And so he's getting some great results. I know we've only got you shortly. He's actually going into surgery. He's going to head out for surgery. We're kind enough to come in. We'd be remiss without talking about some of the wonderful work you're doing with the LVAD devices, these left ventricular assist device. Go ahead and tell us.
At our institution, we have a very robust transplant program for hearts as well as other things. And so we have a population of patients that are on the bridge, which is provided by a mechanical circulatory support, which is very often a left ventricular assist device, which is a power cord. And these devices, you have to carry around power to make them work. And the
external lead,
the exit from the abdomen can sometimes get infected. And it's a challenge to get that cleaned up. And we've had some pretty remarkable results with using the...
Mr. Cobb he's pretty famous. He's got
he enjoys talking about it.
He loved it because he'd had it before and had to take a lot of strong Cipro and really strong antibiotics, and
sure,
and not always works. And you build this resistance to those antibiotics. A lot of times the body does. So this is something. It's not a pill. It's not a drug. It's basically a genuine lithotripsy. 20% of the strength of the big ones in hospitals, and
sure, it's known technology, and so far as we can tell, and it's been studied a great deal, there's no downside to it.
I mean, it might be one of the most versatile devices we've seen in medicine in the last 25 years.
And yet the safest. It's very exciting to be involved with this project, and I'd like to see it continue.
We can't use it over pacemakers, so even if we're using it on the shoulder, we have to be careful that energy doesn't go towards the pacemaker. Can't use it obviously over fetal tissue, and cortisone after cortisone injections I've found. But I mean, I am so excited that we have one out in Chicago now. I mean, we're getting them all over. So we've got to get some other people on board. We've got to find some other plastic surgeons out there and wound care specialists to start.
I would like to invite all the colleagues to give this a try. And I'd like to see some more. Studies done. And
if you're interested, you can go to freemypainnow.com and you can leave you can write up or you can input your data. We'll get that right over to Dr. Mullins. And again, John, it's always a pleasure to have you. In closing, where do you see 2020 in the next year? I mean, we've seen so much in the last year and a half. What do you think? I mean,
Well, I think this is going to become a standard of treatment for many conditions. Like anything, though, there's going to be a certain percentage that are going to be non-responders, and so we try to dial back our expectations a little bit.
You're good at that. I get a little crazy at it, but
nothing's going to be 100%. So we've got to be prepared that there's going to be a high percentage. But in many of these cases, even a 15 or 20% is a win.
Right. Quickly to end, the lithotripsy has an 85% success rate with kidney stones.
Right.
So, I mean, we shoot for that.
15% that don't
So
respond.
if we get 75 to 80% the results, that's great. So thanks again, and good luck with surgery.
Thank you.
All right. Welcome back to Free My Pain Now with Dr. Matt Doduro, and we have Tommy Mako. Tommy, thank you for coming in.
Thank you for having me.
And Tommy came all the way from Montreal, which is our neighboring country, Canada. And Tommy is an amazing, amazing person and human being. But, the reason why we started this show is really to give people an outlet. We wanted them to discuss about how to become their own healthcare advocate.
Absolutely.
Right? You have
Yes.
to.
You must.
And you're living proof of it.
I definitely.
You just
am.
shared with the producers and I that this has been a 22-year
Correct.
mission.
So, my issues or my health issues started at the age of 21 years old, in areas where at a young age you're not supposed to have that,
Right.
which is liver, and I wasn't a drinker whatsoever. Hormone issues, prostate issues.
At 20, 21.
21 years old, I had basically no more libido. It's completely gone. My hormone went high. It went all over the place, my hormone. I couldn't sleep well. I had no sexual drive whatsoever. I blew up. I wish I could show you the pictures. I have a picture that is an 8-month separation, and it blew up. It
Yeah.
just became super sick and ill. I mean, in Canada, we have our social health scare system. I wanna be health scare system.
I've never
That's
heard
what
it called
is.
that.
Yes. And basically, they had no idea what I had. This lasted for many years. With other issues came with it: chronic constipation, chronic fatigue. I mean, I'm a very young guy, and I couldn't train anymore. It was a challenge for me to get out of bed. I did my everyday life. I lived with it as best as I can. And at one point, the pain was so bad that my liver, I used to punch myself. All that to say that I went to the doctors, and after many years, they just said, "Hey, we're going to remove your gallbladder." That's the solution.
Mm-hmm.
Today, I know that's the worst thing I've had to do. They removed my gallbladder. Things got way worse.
Wow.
Again, I lived with the pain. If you think my neck is an issue today, you have to see it back then. So I developed many other symptoms, and things just got worse and worse and worse. And I guess I lived with it. At the age of 32, things changed completely. I got married a year after. I got super sick. And that's where my journey started. So the first thing I was diagnosed with is H. pylori. I went to the medical doctors that I know of, that we have access to. They gave me 7 rounds of antibiotic. Wow. That was the first death sentence that they put on me, because, I don't know if
H. pylori is very tough. Let me tell the listeners, it is these little bacteria, the heliocaptor, they call it, because when they get in, they open up and they get into your stomach lining,
Right.
And they're terrible to kill. And there's typically they give 3 cocktail of antibiotics and plus a proton inhibitor, and it ruins your gut flora.
It destroys it. It doesn't just ruins it. It opens up to other things like parasites,
C. diff.
candida. And I already had candida because I didn't talk much about my where the source of all my issues came. It came from my mouth when I started putting amalgams, mercury. That's a big subject.
Did you start pulling them out? Right. So many of
No, I didn't pull them out right away. I did do it afterwards, but I also had root canals. So the moment they started playing in my mouth, I started having issues. Now I play it back. That's exactly when. And today, with all the diagnosis and everything that I know, and all the I want to say, hundreds of practitioners I've seen all combined. It links all to that, and it's very clear. But also, what destroyed my gut is the antibiotic. 7 rounds of it, one after another, very strong ones. They basically killed my gut.
That's terrible. And now, science shows there's a direct link between your gut and your brain.
Absolutely.
So you probably had brain fog and all this
All
other
the
stuff.
time.
The other part of this the reason why I wanted to have Tommy on, and we met through Dr. Pompa, who's going to be our guest on episode 26. And thank you. He's introduced to so many wonderful people.
He is, man. He's an amazing man. What I love about Dan is, first of all, he is human. And why I say that, because I've met so many different doctors and practitioners. I mean, before meeting Dan, I was day in, day out for 8 years looking to resolve my issues. And I don't have time to go through all my issues, but I had Lyme disease. Wow. That I'm actually Lyme disease free today. I mean, parasites and candida. When Dan started working with me, they purged by the hundreds. I've had 2 feet long, 3 feet long worms coming out of me. I saw them. I have pictures of them.
Wow.
It's real. I mean, this is real stuff. And Dan came into my life, and within 2 years, he dramatically changed my life.
So we had Dr. Jay Davidson on also, who talked about how they do, farmers used to do parasite cleanse twice a year back in the day. And we've kind of lost that. And they all affect your mitochondrial. And that's what it is. Your mitochondrial were so sick. And I was lucky enough to be a guest speaker on the Mitochondrial Summit. And I learned so much about from these other experts around the country. But, you're living proof. Like you never gave up. You are persistent.
Never gave up. And as I said, I literally had almost everything. Every symptom a patient could have, I had it on one, whether it's emotional, physical, biochemistry, you name it. I had it,
Today, you're 85, 90% better, 70? Where are you on the...
Overall?
Yeah.
I'm at a good... From the day I met Dan, which is 2 years ago. Remember, I worked with other doctors.
Yeah, you
many
went all over the world.
I was a fruitarian, a vegan, a vegetarian, paleo. I did it all until Dan came in, and his approach was amazing. And he's a godly man, and I am a godly man since then, because I prayed to God, and Dan showed up by God. That's definitely
that is. Things don't happen by chance.
No, they don't. No, they don't. It's only when I gave up and I said, God, you take control. This is when Dan showed up. That's
pretty wild. And you're very lucky. 2 years of working with him. You've gone through his detox cellular formula.
Yes,
absolutely. You go to a lot of his events, and that's how I got to meet you. Also, I want to say that you're a very, very successful businessman.
I am.
And you do some really cool things. And I appreciate you coming into my clinic and talking to my staff and just getting our team and our culture set right.
That's my passion. My passion is building teams, building things, building businesses.
From scratch.
Absolutely. And that's how I like it, And why I came to see you, I met you in LA, and I love your personality. You have a cool personality.
Hear that,
guys? You're genuine, and you're just not a practitioner. You are a nice human being that cares for people. And I saw that in you. And then I tried the TRT machine. And so I've had neck issues.
Stem cell machine.
Oh, yes. Yeah. And by the way, I've done stem cell injection, PRP. I've done the NK that I spoke to you about in Cancun. They're all invasive. They're good, super expensive. If the cheapest way to get stem cells into you is the TRT. Right. And I think it's most effective because you can see it right away. The results, like bang, boom, right away. Right. It's like you finish the treatment and it's like, oh my God, like I just did one on my ankle today and already my ankle feels better. So my neck issues, and that's one of the issues I've had. It's literally, I had a car accident when I was young.
You told us.
Since
really
then,
tough.
And I've injected it with everything. Ozone, PRP, homeopathic, stem cells. I've done all the therapy possible you could have. Trigger point injection. I did everything. Dry needling. I mean, I can go on and on and on and on. One of the most effective and the fastest result I've had, it was with the TRT.
Really?
Absolutely. And that's why it kept on my mind when I did it in LA. And, in LA, everybody wants to treat me because I have everything. I have everything, But TRT stayed in my mind. And that's why I decided to bring my mom.
Yeah. He brought his mom down.
Absolutely. My mom fell on her hand.
He's right here in the studio.
She fell on her hand and broke the 2 fingers. And without me knowing, she went to the doctor because she knew what I would say. I would say, no, don't go. She went for a day surgery, came out of there. Since then, her hand is pretty damaged.
We should show. Come slide in the camera, Dale. You might want to see this. This is. She was not able to move her hand really well, and we've had 2 treatments. Go ahead, squeeze your hand.
Squeeze your hand.
Look at that, how nice that is. Open. Yeah. That's better than yesterday. So 2 sessions, we got it moving again, and you feel better, right?
Yeah.
Yeah. It's painful. Thank you. Thank you. I mean, that's
So-
what it talks about. You trust us to take
Absolutely.
your mom,
Absolutely.
you know, some of the most important people in your life. You want to get this care to.
Absolutely.
And
And I
what-
tried it first, though. I mean, I
Yeah,
had to
you
try
have
it first,
to.
and it's like, no, this. I have a lot of. You see, I'm not a doctor. I actually don't even have high school, by the way.
It's amazing.
I don't
You're-
have high school, but I had to teach myself. I have to do the research, and I tried everything. So before I suggest something, I ain't gonna lie about it. That's for
Right.
sure.
No.
I try it and see if it works. I give you another thing. I've tried something similar to your therapy, and it does not work.
The radial device.
I'm not gonna say what it
Okay,
is,
good, okay.
but there's something that actually Dan proposed to me. I went, I did it. Didn't work for me. I didn't like it, and I tried it in the past. So it's not something I advocate.
You know,
whatsoever.
you made a great point, Tommy, that, you know, stem cells may be the future of healthcare. We've said it numerous times.
Definitely.
But right now, they're the future for professional athletes and millionaires. This is an opportunity for everyone to
Yes,
be.
it's very affordable.
Yeah.
I mean, it's very, very affordable, you know. And the way I know you work with your patient, and that's very important to work with your patient. It's
Absolutely.
I
We want
applaud
this-
you for that.
We don't want to trade their pain for a financial pain.
Exactly. No,
And that's all it's about.
and stem cells will do that. Will definitely do that. Stem cells.
Good.
And you are the solution, alternative for people, everyday people. That could
Thank you
get
so
this
much.
treatment.
It was really
Thank
a
you.
pleasure to have
Thank
you
man.
and your
I
mom.
appreciate it. Thank you
And
so much.
thank you guys so much. All right. That concludes episode 25 of Free My Pain Now.